The following portion of Good Day PA is sponsored by WellSpan Health. It's estimated that up to 12 million Americans are affected by peripheral artery disease. And even though that number sounds high, research suggests that most of these people don't know they have PAD. Dr. Paul Impellizzeri with WellSpan is joining us to empower viewers to get screened for PAD. What is it? What causes it?
Well, peripheral arterial disease is really a systemic process. But we call it peripheral when it happens, for example, in the periphery, like the legs. Most of the patients I see, it happens in the legs. But it could happen in the brain and cause strokes. It could happen in the heart and cause heart attacks. And basically, it's the accumulation of fatty deposits that become calcified and hardened over the years and actually narrow down the vessels. Some people years ago used to call it hardening of the arteries. And it truly is that, because the vessels do become hardened and they become narrow, and then you can't get the blood flow that you actually need to get to the target. In particular, with the vascular surgeons see in the legs and the feet. There's a wide spectrum of disease, but the worst consequence could be gangrene or wounds that lead to amputation.
Ooh. So are people aware that they have it? Like, do you get symptoms?
Well, there's a whole spectrum. A lot of people out there will not have symptoms at all. They could be walking around without symptoms. That's why it's important to always go to your primary care doctor. They give you an exam. They can kind of detect these things, and then you can make adjustments in terms of your overall health. But then there are other patients who will only experience symptoms when they're exerting themselves. It's kind of like chest pain. So people who exert themselves get chest pain because you're trying to get energy and oxygen to the musculature, but you can't do it because the blood vessels aren't allowing it.
Sure.
If you're, for example, walking or going up a hill, you may get cramps in the lower extremities, and that's the manifestation. In the most severe cases, we call that critical limb ischemia, and that's where patients have wounds that won't heal, they have gangrene, they potentially have pain in their feet at all times, worsened with elevation, and they get better with dependency. Those are the most serious patients that need to be treated on a little more urgent basis.
Well, who is likely to get this? Like, is it dietary? Is it hereditary? Like,
well, I'll tell you, I don't see many healthy people come into the office. Not people who are non-smokers, who have a proper diet and exercise. Those aren't the patients. Unfortunately, most of my patients are smokers who have blood pressure issues, cholesterol issues, and diabetes. So that's why it's really important that when you have those, to keep up to date and see your doctor regularly and do the best you could do to alleviate the consequences of the disease.
Well, sure, someone might think they have some of those risk factors, but again, maybe they aren't experiencing any symptoms, so they think, oh, yeah, I mean, I'm not going through that, but what should they do? They go to their doctor just in case?
Well, sure. They can start with their primary doctor, and they are trained to pick up the symptoms and make the appropriate referral. And the doctors who are best suited to treat this are the vascular surgeons. The vascular surgeons, that doesn't mean you're going to get an operation. We see the whole spectrum of disease. And some of the services we provide are counseling, medical care, but those who do need interventions, we are trained in doing balloons and stents in an endovascular fashion, but we're also trained to do the open surgeries when they're required.
If somebody really wants to learn more about this, maybe they think they should be evaluated, how do they reach out to you?
Well, you can contact our website or the phone number listed on the screen. You could also reach out to your primary care doctor who can get you seen.
Very good. Nice to have you back with us.
Thank you. Thanks for having me.
You're very welcome. The previous portion of Good Day PA was sponsored by WellSpan Health.